Dr. Jim Orvick from the Oregon Vet Clinic is here taking your pet calls at 270-9933. Good to see you again.
Good to be here.
This canine flu is in the news, and now we hear that the vaccine they have may not necessarily attack the strain that's out there.
It's just like the human flu vaccine last winter. A different strain was coming through, and the other thing is the strain that it is effective against is around too, so it's worth it to get vaccinated.
So your advice is to get the dog vaccinated?
Oh, I think so, yeah.
But
and they always talk about some cross protection too.
But the other problem is there's a shortage.
Yes, that's what I understand.
So what would your advice be? To call up your vet, get on a list?
Yep, I would guess that would be the way to do it.
And why did we hear about this dog flu before?
Well, they discovered it not too long ago. Years ago, I had a greyhound client who the dogs were dying at the racetracks, and they thought it was kennel cough. And vaccine wasn't helping, and they checked a little closer, found out it was a flu virus. And so it started from there and finally got into the general population.
It started at the greyhound tracks, and we didn't have any here by then, so...
Right. It was all down south.
But now it's made it here.
Now it's here.
Get vaccinated.
Okay, yep.
All right, let's go to the phones. We'll start with Carol in Oregon. Hi, Carol.
Hi.
Hi, what's your question?
Yes, my dog just had a seizure, and I was wondering if it's hereditary or generic.
Genetic? Well,
What kind of dog? What kind of dog?
Oh, she's a black lab mix.
how old?
She's 3 years old.
3. All of the above is possible. It could be something else too. Usually what I always recommended, if a dog had a seizure, to get it checked out, complete blood panel, and make sure there's not some other problem, especially in a younger dog like that. There are some liver defects and things that dogs can be born with that can cause seizures that you can help with other things other than seizure medicine. Most likely it is epilepsy, but labs I know will run until their blood sugar drops and they'll have seizure too. So
get it checked
a lot of things to consider.
All right, Jeffrey in Madison. Hi, Jeffrey.
Hello?
Hi, Jeffrey. What's your question?
Yeah, I had a question on how to identify about this flu that's going around with these dogs. Is there anything I should be looking for?
Yeah, it's symptoms of the dog flu. We didn't get into that.
Fever, off-feed, coughing like human flu. Cough especially because at first they thought it was kennel cough. So it's similar to that, but a little more severe.
You treat it the same way?
Yeah, virus, supportive care is all you can pretty much do.
And avoid contact with other dogs?
That's right. So dog park, it's up to you.
Hold off.
Right.
All right, we are out of time. If you're on the line, stay there. Dr. Orvick will talk to you off the air, and we'll see you next month.
Okay.
And we'll be right back with a final check of your forecast.